Hi! Welcome to Surviving Schizophrenia with Steven. My name is Steven. I hope you're having a wonderful day. I'm here today with my dad.
I'm Steve, Steven's dad.
And we're going to talk about my experience with Clozapine, as well as other antipsychotic medications.
So Clozapine is a second-generation antipsychotic medication. Steven has been on Clozapine since mid-2013. It's been about 10 years now, coming up on 10 years. And it is considered the gold standard for treatment-resistant schizophrenia. And it was recommended to us in 2012 when Steven was discharged from UCLA Resnick Psychiatric Hospital, Neuropsychiatric Hospital. That was the end of May 2012. And the doctors there said that they would put their son, if Steven were their son rather, they would put him on Clozapine if the Zyprexa didn't pull him out of the psychosis. So when he was admitted for 2 weeks there at UCLA in 2012, Steven was on Zyprexa, and they titrated him up from 5 milligrams of Zyprexa to 15 upon discharge. And, we waited another year to go to Clozapine. And there's some regrets there we'll talk about. So, Steven, what has been your experience on Clozapine?
It's been amazing. It brought me back from psychosis to reality. It improved my clarity of thought massively. It reduced all the really major symptoms of my schizophrenia that would really impact my life.
Yeah, it's absolutely amazing, and because we didn't see the resolution to the positive symptoms and the negative symptoms by use of Abilify or by use of Zyprexa. So Steven was on Zyprexa, titrated him up to 20 milligrams a day. Did that was on that medication for several months. That wasn't pulling Steven out of the psychosis. We then went to Abilify, titrated him up to 22.5 milligrams a day of Abilify, was on Abilify for 6 months or so, and that wasn't pulling him out of the psychosis either. And, we waited, and the reason why we waited for that 1 year to go to Clozapine is because all the potential side effects, and there's just a laundry list of potential side effects that you can have with Clozapine. One of the ones that we were most concerned about, was seizures. It can cause seizures. Now, Steven, have you ever had any seizures with Clozapine?
Nope, never had a seizure from Clozapine or anything.
I think that's so awesome. And I think that we were careful in titrating him up only to 175 milligrams. I think that's what you're on.
That's what I'm on right now still.
Right, and the most that Steven took on a daily basis was 200 milligrams. Mm-hmm. So the psychiatrist didn't titrate him up higher than that, and I think that also was helpful.
Yes, I totally agree. I might have worse symptoms, or rather side effects, had I been on more medication.
Right, and the regret that we have is not starting Clozapine sooner. Yeah. We should have followed, in hindsight's 2020, the psychiatrist's recommendation to UCLA that we switch him to Clozapine if the Zyprexa wasn't successful. And it's interesting because UCLA's recommendation to switch to Clozapine after only failing Zyprexa is contrary to the guidelines, the prescribing guidelines for Clozapine. The guidelines provide that Clozapine should be prescribed only after the person has failed 2 antipsychotic regimes, satisfactory dose for a satisfactory period of time. And we did that with Zyprexa and Abilify, those two. But in looking back, UCLA would have put Steven on Clozapine had he only failed one antipsychotic drug. And I think that's important because it is important to realize that there's no set procedure here. The psychiatrists are prescribing these drugs to treat symptoms. Mm-hmm. And there are guidelines and best practices, but different psychiatrists are going to have different views
For sure.
on what should be prescribed. So what are some of the side effects then, Stephen, that, well, let's first talk about some of the potential side effects. Okay, the seizures would be one.
Loss of white blood cells.
Right, and that's monitored, right? That with monthly blood monitoring.
Yes, I get my blood drawn once a month, or really once every 30 days. I don't know if you can see on camera. I got my blood drawn yesterday even. And it's not that big a deal. I got used to it pretty quick.
Yes.
Now it's just routine. Doesn't really hurt. It's not really that big a deal to me. A little annoying. I have to go every month, but it's not that big a deal. And actually the phlebotomists at the lab I go to are really great people. So nice. So it's not that big a deal.
Right, and so they're monitoring the white blood cell count. We've never seen a depletion in Stephen's white blood cell count. So it's never fallen. If it falls below a certain level, then you have to discontinue taking clozapine, at least for a period of time. So it's monitored. It's very rare to have the loss of white blood cells caused by clozapine treatment, but it's certainly a possibility.
Yeah.
I think it usually would occur within the first few months of titrating onto clozapine, but I'm not 100% sure about that. But it has to be monitored. It's monitored around very carefully. Never seen a problem there.
No.
Don't expect to see a problem there.
No. It's nothing I'm worried about or anything.
Right. The seizures, going on to clozapine, we were very concerned. We thought maybe Stephen should be hospitalized to titrate onto clozapine because of all these potential side effects, particularly the seizures that really scared us. And that's why in part we waited so long. So but we didn't do that. We titrated at home on the clozapine eventually when we went to it. The another couple side effects that are significant would be enlargement of the heart muscle and heart arrhythmia. So
now I do have some heart arrhythmia. I know that because every once in a while my heart goes dum 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 or something like that. And again, doesn't really bother me. I get used to it. It's a little annoying. It's like, it's doing that thing again.
Right.
But it's not painful. It's not anything that makes me faint or anything like that.
Right. It hasn't disrupted your life in any way.
Nope, not at all.
Right. So that's a minor. That's a minor side effect, at least at this point.
I've had are they EKGs where they scan?
Yes.
Yeah, I've had those in the past. I even wore a holster. I forget what they're called now to monitor my heart at one time. And really no issues. I do have a fast heart rate, but
right. So we keep an eye on that. That could also be caused by anxiety. So some of the other side effects, would be, what would those be, Stephen?
Excess salivation, which I definitely have. At night especially, I have an extra pillow to swap out if it gets too wet. As well as also excess, but sweating and stuff. I tend to overheat very quickly. I don't actually know if it's me overheating or just something else, but it's as if I overheated, and like if I'm sitting for too long, my back will be kind of wet.
So some of the other side effects could be dizziness and tiredness.
Definitely have tiredness. That's for sure.
What about dizziness? Do you have
dizziness? Yeah, but not to a major degree. If I get up too quickly from a chair or something, I'm like, ooh. And then I'm good. That's it.
But otherwise, you're not affected by dizziness issues.
No, not really.
Right. Again, going back to tiredness, sometimes that's hard to know whether it's, the medication, all these different antipsychotic drugs. And Stephen is also on Abilify, 5 milligrams, and that can cause tiredness as well. And many of the antipsychotic drugs have similar profiles as far as, or share some of the similar side effects, such as drowsiness and tiredness.
I also want to add weight gain is a big issue. And it was for me for a while as well. But I learned that if I eat healthier, essentially, I'll do better. As well as exercise. But because for a while I was eating bread with tons of butter at night and stuff, and Nutella sandwiches for lunch. None of that's healthy. So what I did now is, especially at night when I get hungriest after dinner, I have dry cereal, pretzels, crackers, vegetables, that kind of thing. Stuff that's not that full of sugar and calories, so I can eat a ton of it and not have much of an impact on my weight.
Right. Try to focus, as much as we can on vegetables, fruits and vegetables, great, nuts.
Nuts, that's the other thing.
Yeah. Avoid sugary drinks, and Stephen's just always done that anyways.
Yeah,
so
I don't have soda.
So you don't have a problem with your weight?
No.
No. It's you look great, Stephen.
Thanks. I have been exercising again. Now, I did make a video a while back saying I'll start exercising, and then I'll be honest, I didn't keep it up. But I'm working on that now, and the last few days I've been taking good, like, long walks. And that's helped a lot, actually, with everything.
You know, and with the Clozapine therapy, Stephen, you know, looking at you today, I could say that, you know, it doesn't really look like you have schizophrenia. What do you say to that? Because it's so true. It doesn't.
It is true. Especially with Clozapine, like you said, I might look so much better, and I am so much better, but at the same time, like whoever's looking at you, might not see, well, let's take it as depression. You might look at someone, and they could be very depressed, and you don't know that they're depressed necessarily. It doesn't always show. So just because I might look fine, doesn't mean I actually am completely fine.
Okay, so let's just talk about that.
Yeah.
Right now, let's try to break that down a little bit,
Okay.
if I can.
Go for it. Yeah.
Okay, so how do you feel now, Stephen, as far as, let's talk about clarity of thought, your thinking. Is it seem clear or is it fuzzy?
My clarity of thought, I think, is slower now than it used to be, but it's very good otherwise.
So
because of Clozapine, again, that really made a huge difference.
It doesn't seem fuzzy or anything?
A little, but not that bad.
Okay. What about anxiety? What do you would be feeling right now? No, but like right now.
Right now?
Yeah. I would trying to explore what you're
right now,
feeling.
I'm not that anxious. I always have a little overlying stress in the back of my head. I'm not dwelling on it, but some part of me is always a little depressed as well. Even if I don't look it or think about it outwardly, I know in the back of my head I'm always a little down.
Right, and that's it's been such a difficult illness that you've gone through, Stephen, the last
traumatic too.
10 years, right? So that is not surprising that you have that kind of feeling in the back of your head and that it's there. I think that my hope is over time that will even go away as you look to the future, and not only with your channel here, but in doing other things in the future to be productive, and that kind of productivity gives one a feeling of self-fulfillment.
I also want to add, since taking Clozapine, my sense of detachment from myself and also reality greatly improved. To this day, I'm in reality, but I do feel a little detached still. But that's been a lot better since Clozapine, for sure.
Oh, that's interesting. So, in fact, I think you mentioned that last night. We were talking about shooting this video. So, how would you describe that a little bit? Can you describe that a little bit?
Almost like I'm looking through a lens, I guess. Almost.
Right. Sometimes you feel that way, or you're...
Yeah. It's not constant, but definitely every day. I don't know how to describe this any better than looking through a lens that's me.
Interesting.
Yeah. That one's hard to explain.
So that's our experience with Stephen's experience with Clozapine. Our experience, Stephen is on 175 milligrams a day of Clozapine. He's also on 5 milligrams of Abilify
and a little bit of
Lexapro.
Yeah.
Well, let's tell you. We can talk a little bit about how we got there on why he's on Clozapine and Abilify at the same time. It's Polypharmacy. Antipsychotic polypharmacy is the prescription of more than one antipsychotic drug at the same time. So it turns out, Stephen was on Zyprexa at UCLA Neuropsychiatric Hospital in 2012. We titrated up. That didn't relieve symptoms, positive symptoms of schizophrenia, the psychosis. We then went to Abilify. That also didn't fully relieve the symptoms. We did see a positive reaction to the Abilify. There was some improvement in the positive symptoms, some alleviation of those positive symptoms, which again are the hallucinations and delusions with Abilify, but not completely. And we'd been on Abilify for 7 or 8 months, probably about 7 months at that point. And so then going to Clozapine, absolutely wonderful.
Yeah. That's it. It's been absolutely wonderful. Yeah.
So Now, what about Stephen? So Stephen, what about discontinuing clozapine? What can you tell your audience? What is your thought process, and what have you discussed with your psychiatrist about how long do you have to take clozapine?
Yeah. For the rest of my life is the short answer. And I'm prepared for that, and I have accepted that. I know it has helped so much, and that if I do stop taking it, it's very likely, maybe not right away, but over time I would slip back into psychosis or have other horrible symptoms of my schizophrenia to come back. So I don't ever intend to go off it. Maybe who knows, near or far future, whatever it is, if there is a new antipsychotic medication that could work even better than clozapine has, and it's been around for a while and is working, then maybe I consider trying and switching, or maybe taking both and reducing Abilify or something. But as of right now, I never intend to go off clozapine.
So that's very consistent with what Stephen has just described there with the research I've done independently into different antipsychotic drugs and clozapine as well. It's also consistent with the psychiatric advice that we're getting for Stephen. And what that research shows is, well, step back here for a second. Stephen has been so successful on clozapine, and he's been so steady for the last 7 or 7.5 years with no psychosis that it really has been the miracle drug in Stephen's life.
Yeah.
And it's the drug that works for him.
Yes.
So to switch to discontinue it would be a mistake, because even though he's feeling so much better and it has helped so much, to withdraw that medication would be a very high chance of relapse.
Definitely.
A very high chance, what we've seen in research, a higher than 70% chance of relapse over the course of what might be another year or so. So, that is once you're stabilized on one of these medications with such success that we've seen, I think that the typical advice, and the advice that we're getting from Stephen's psychiatrist, is not to change anything, to just stay the course. Now, my hope, of course, as Stephen's, is that there'll be better medications, and in part that's what I hope that this channel will bring about, and that what we can help bring about by encouraging researchers and to continue to investigate and find better medications to treat schizophrenia.
Yeah.
So coming back to why Stephen's on Abilify and clozapine at the same time, when we titrated onto clozapine, Stephen was on Abilify. So the psychiatrist did not pull the Abilify all the way off the table. She titrated it back down to 5 milligrams from 22.5 while we were titrating up at the same time on clozapine. And, she has maintained him on that. In the last few years, keep trying to get her to drop the Abilify. It's been almost a running joke among us.
It's true.
And I've failed on that course. She has not dropped it, and it's working. I mean,
there's no need to mess with something that's working necessarily.
Right. It's all working, and she's the expert. We trust Stephen's psychiatrist, yes. And so even though I'll test her and suggest that maybe she should drop the Abilify, reduce that, she always resists my suggestion and gives me a little bit of homework. Usually research a few things, and then we come back. So it's been really nice also to be able to collaborate as a parent with Stephen's psychiatrist. We're able to do that because Stephen, in part because Stephen fell ill when he was 12, and so he was a minor at the time. His psychosis lasted for a good 1.5 years, so we were as parents, me and Maria, we were the point people in talking to his psychiatrist and deciding how we were going to on what Stephen was going to be on, and whether we were going to take the psychiatrist's recommendation. And of course Stephen was talking to the psychiatrist as well.
Yes.
So it's been a very collaborative process, and that's been fantastic. So discontinuation not likely, but that's also a concern too, with all the side effects. It would be nice to have Stephen on a medication long term. He's only 23 now. He's been on clozapine for almost 10 years.
Decade.
Yeah.
Almost a decade.
So the hope is that at some point he could titrate off of it. If there were a better medication, we don't see that in existence as of 2022. So yeah, I think that it's fantastic what clozapine has given Stephen. It's widely it's understood to be widely underprescribed.
Yeah.
Clozapine is looked at and considered a treatment of last resort for treatment-resistant schizophrenia, and so that in and of itself causes people, and it caused us, to hold off on it and not go to clozapine because we were thinking, or at least I was, what if it doesn't work? And we had a comment that suggested something similar to that, and that is a concern, I think, on any drug that is considered of last resort. It would naturally cause people to be worried that if it doesn't work, then
what are you going to do?
What are you going to do? So that may cause people not to go to it. You might try a number of other things. And what I read is that a lot of times, people aren't going to clozapine until they fail 2, 3, or 4 other antipsychotic drugs. Yeah. And so they're going through this process of suffering for sometimes months or years, unfortunately unnecessarily, because of all the of what it's considered, clozapine, the drug of last resort.
So I think that's all we got for this video. I do want to say, if you have any questions and maybe something we didn't answer in this video about clozapine, please leave it in the comments below. I will try to get back to you, and maybe we'll even make a video talking about your question. We hope you have a happy and healthy rest of your day, and hope to see you in the next video.
Have a great day. We'll see you in the next video.
Bye.
Bye-bye.